Good afternoon, everyone. Thank you for joining us today. A quick time check, it's 4 p.m. in Singapore and 3 p.m. in Laos PDR on the 28th of July, 2021. It's a great pleasure that I welcome all of you to the third webinar in the series on adolescent health and development, co-organized by the SingHealth Duke-NUS Global Health Institute, SDGHI, and the United Nations Population Fund, UNFPA, in Laos PDR. I am Hema, and I'm a research associate at SDGHI. Today, we're gathered for the third webinar on adolescent sexual and reproductive health in Southeast Asia. We'll be talking more about the challenges present in adolescent sexual and reproductive health in the region and highlighting the importance of engaging with the topic to ensure a safe and healthy transition into adulthood for our youth. For this, we have with us experts in the fields of adolescent health from Malaysia, Laos, and Indonesia. A few quick housekeeping rules to note before we move ahead. As you know, this webinar is being recorded. Please do keep yourselves on mute at all times and feel free to send in your questions using the Q&A tab below. The questions will be addressed at the end of the session after the moderated panel discussion. Before we find out more about our speakers today, I'd like to introduce Ms. Mariam Khan, who will be moderating today's webinar. Ms. Khan currently leads the UNFPA Laos office as the country representative and has 22 years of diverse experience in leading and managing development programs, humanitarian response, change management initiatives, and working with multicultural teams. She brings a passion for promoting a rights-based agenda that focuses on improving lives of women and young people in particular through culturally sensitive approaches and evidence-based methodologies. Ms. Khan, thank you for joining us today, and over to you.
Good afternoon, everyone. Pleasure to be here. Welcome to the third in a series of 4 webinars that we're organizing. And I'm really pleased because we've got some exciting panelists today. Each one of the 4 panelists will be presenting. They range from experts in advocacy, policy dialogue, health sector specialists, as well as young activists. And after their presentations, we will have a question and answer session. So without further ado, for the webinar today, I'm very pleased to present the first presenter, who is Ms. Sivananthi. Siva is currently the Executive Director of the ARROW, Asia Pacific Research and Resource Center for Women. It's a regional feminist organization working on sexual reproductive health and rights and gender equality across 15 countries in the Asia Pacific. And ARROW has over 70 partners across the world. Siva has authored regional monitoring reports on the progress governments have made towards their commitments to gender equality and sexual reproductive health and rights in this region. Under the title Reclaiming and Redefining Rights series published by ARROW. She is also a She Decides champion and sits on the leadership of the Action Coalition on Bodily Autonomy and Sexual Reproductive Health and Rights of UN Women. And she's also on UNFPA's Global Advisory Council. So without further ado, Siva, over to you for today's first presentation.
Hi, everyone. Good afternoon, and it's a great pleasure to be with you all. Mariam, thank you for inviting me, as well as the team in Singapore. I wanted to actually quickly say that my presentation is based on ARROW's reports around the ICPD Plus 25, which just took place 2 years ago. And as well as our work in the region with young people, which we are really very committed to. So I'm putting inside the chat box the report itself, because this presentation is not a very data-intensive presentation, because it's taking place at 3 p.m., 4 p.m. I'm quite sure that you can read it all later for your interest. So adolescent sexual and reproductive health and rights. Marielle, can I have the first slide, the next slide? Yeah, so 1 in 4 in the Asian region are under the age of 15, and this is about 26% of the population in Southeast Asia specifically, and 50% of this group are girls, right? Next slide, please. Yeah, so the ICPD, or the International Conference on Population and Development, which took place in 1994 in Cairo, mentions and foregrounds the rights of adolescents with regards to the right to education, especially a secondary school education, the right to sexual and reproductive health information, services and counseling, the right to delay marriage and have full and free choice in marriage-related decisions, the right to be free from gender-based violence, and the right to be equal within family and community through gender equitable roles and attitudes. So these are like kind of a very, in today's language, we would say it's a very intersectional understanding of what are the kind of key rights and key program and policy interventions that are necessary for adolescents to thrive in the world. Second slide, please. Next slide, yeah. So adolescents specifically, as defined by the WHO, fall under 10 to 19 years of age. And the definition for young people and youth kind of differs between 10 to 24 and 15 to 24. So rather, when we talk about adolescents and young people as a population, we're looking at 10 to 24 in the range, right? But adolescents alone are 10 to 19. The rights of adolescents thus, are covered by the Convention of the Rights of the Child, because the Convention of the Rights of the Child is about those who are below 18 years of age. And hence the rights of adolescents, also sexual and reproductive health, and a number of those issues mentioned in the previous slide on what ICPD had foregrounded, are also covered by the CRC. The next slide, please. Yeah. So when we talk about a group, like a demographic group, like from 10 to 19, we need to also look at the intersectionality and the diversity that is in this group, right? And how does it pertain to our region? So the first is, of course, age, and in our region, in the Southeast Asian region and in the Asian region, you can see that we have still continued to be a very hierarchical society, and they're embedded in the value system and the culture of our society is this idea of filial piety. And in Confucian societies such as, Vietnam, Cambodia, Singapore, you can see that filial piety is sometimes, kind of seen as the first basic foundation, of the way that society constructs, both morals and ethics, right? Embedded in that is also respect towards elders and a respect for maintaining social order or, for the good of the collective. And these come both with like positive and negative repercussions, right? So age discrimination, although it's not thought of as age discrimination, is something that is very apparent in our region. And okay, so the second one we want to look at is, of course, gender. And in gender, we can see that son preference continues to be a strong theme across all countries, where males and firstborn males especially are actually dominant or prioritized within family structures and about allocation of resources, right? And it comes from a range of things like the ability to inherit the family name or the surname, the ability to inherit the family business, and as well as have a share of, the house or the assets of the family. And within this patriarchal familial structures, the gender norms are strengthened within families. And this, so we want to say that, that 50%, of adolescent girls, this is where adolescent girls are actually kind of learn of all of this gender norms and gender roles within this patriarchal family structure. The third intersection we really need to also look at is actually also poverty, and although the Asia Pacific region has been held up, and Southeast Asia especially, right, has been held up kind of in the 90s, they were known as the tiger economies. Nevertheless, there is great inequality within the countries of Thailand, Singapore, Malaysia, so to speak, right? And now with the COVID-19 pandemic, the emergence of what is called the pandemic's new poor is something that we really need to focus on. And, and this is, of course, a situation that is kind of unraveling as we speak. And I don't think that anyone actually has that, how do I say, complete understanding of what that looks like yet. But we can actually look at how this really affects adolescents and young people. We already know education has been delayed. And those who have gone to university and graduated are perhaps left with student loans and they cannot get into the economy or work. So we can see a delay in being able to complete or access education as well as employment opportunities. So this will at least take 2 to 3, 4 years of productive life from young adults, right? So, and then the last one that we really need to also pay attention to is exclusionary status. So across the region, we have different countries, and you can see that ethnic religious minorities face exclusions, and indigenous, disability, migrant status. These are all the different types of status that further excludes people from realizing their sexual and reproductive health and rights. Next slide, please. Yeah. What are the key issues? This is just like, a kind of a bullet point thing, but we can see that their unintended pregnancies is one of the key things that adolescents face. Across the region, especially countries that do the demographic health surveys, and the data from those DHSs actually show us that usually there is a data that is collected. It is called, you can see amongst the age groups of women, those who wanted a pregnancy or wanted it later or did not want it at all, right? And if we look at this across all of the different age groups, unintended pregnancies or inability to access contraception and use contraception is usually highest in the younger age groups, which is 15 to 20 and 20 to 24, according to the DHS. And then we have also unsafe sex, so the inability to protect oneself from HIV and sexually transmitted infections is also something that is high. SCAP has noted the rising numbers of HIV amongst the young in our countries. Violence is another, and of course we have child and early marriage, which is an indicator of lack of choice and agency, and is also early age marriage can be a predictor for violence within the relationship. The next slide, please. Oh, sorry, no, not this. Next one. Yeah, so what are our strategies, right? Capacity building so that young people have the right to sexual and reproductive autonomy and agency is very much required amongst the young youth-led organizations that we are dealing with. We also try to create spaces for young people to participate in formulating their advocacy briefs or bringing their voices to governments, right? And these are held through youth forums, which we work with the UNFPA, and the multi-stakeholder dialogue on comprehensive sexuality education, which actually ARROW convenes with both UNFPA and UNESCO every once in 2 years. We also feel that monitoring is something that's very important, and we utilize the SDGs and human rights standards and mechanisms, and using age disaggregated data in the SDGs is a way of bringing the youth situation forward in order to hold governments accountable to the development of young people. And we utilize advocacy in order to elevate the voices and priorities of young people. Next slide, please. Yeah, so the accountability is for young people is critical and in the region, because young people are both critical stakeholders in decision making and how policies or programs are crafted. And young people also have the right to review and monitor how these policies and programs fulfill their sexual and reproductive health. A few years back, we worked with the Laos Youth Union in Laos PDR itself. And in the countries of the Mekong, we can actually find that the voices of young people have kind of over the past 2 decades, been able to actually provide some form of sexual and reproductive health services to young people within their service provision streams. The next slide, please. Yeah, so it used to be that, this was a call by the HIV community, but nothing about us without us has actually become the rallying call of young people in the region, and they've been mobilizing in the last decade. In this particular pandemic period, we can actually see that their voice and influence is being felt everywhere in the region. So I think that's my last slide, is it? Yeah, thank you.
Great, thanks, Siva. Always good to hear you speak. And thank you for setting the stage for the region as to the issues pertaining to ICPD. And I think many of you may have seen recently the Bodily Autonomy State of the World Population Report that was also launched. Since we have a spotlight on Laos, please hold your questions because the next two speakers are from Laos. There is the Q&A box. You can enter your questions there, but I'd like to introduce the next team, which is going to speak. It is Dr. Sumana Ratana. She's the Deputy Director of Healthcare in the Ministry of Health in Laos PDR. She leads the improvement of quality of care for health services in Laos, and this includes adolescent and youth-friendly services within health facilities. She's playing a very important role in the development of the National Adolescent and Youth-Friendly Service Guidelines in the country and rolling out the youth-friendly services at the national, subnational, and community level. She's also part of the management team in the Ministry of Health that is leading the pandemic response to ensure that Lao people remain safe, practice prevention, and that young people and adolescents are also involved, informed in the COVID-19 prevention efforts. And she also has been instrumental to ensure that there is continuity of youth-friendly services, sexual reproductive health services during the pandemic. She is joined by Siripon Sally Sakulku, who is the lead for the Sexual Reproductive Health Program in the UNFPA Laos office. Sally has been working in UNFPA Laos since 2013, and her main work focuses on supporting the Ministry of Health in the reproductive, maternal, newborn, child, and adolescent health strategy. And I emphasize the adolescent in the health strategy. She provides technical inputs as well as rolling out management support to this strategy. Prior to working with UNFPA, Sally has a rich experience with INGOs, and she is a registered nurse, which she worked as back in the day. She has an active engagement in and knowledge of the Lao context. So I will give the floor over to Dr. Sumana and Sally.
Okay, thank you, Mariam. Good afternoon, everyone. Ladies and gentlemen, that's a great honor that we had opportunity to share the resilience and experience from adolescent sexual and reproductive health program in Laos at this webinar today. Next, please. Some may know Laos is the landlocked mountainous country with a highly dispersed and thinly spread population. Half of population is aged below 25 years old. We have many young population in the country is a diversity with 50 ethnic groups, and the cultural barrier is still exists in communities and sub-rural regional. In previous year, limited access to adolescent and sexual reproductive health information and services, limited of knowledge and experience on adolescent youth-friendly services, limit adolescent youth-friendly service facility, which contribute to early marriage and high adolescent pregnancy is one of major issues in Laos. 4 out of 10 girls drop out from school. The fertility is also high, 2.1 in urban to 3.9 in rural without laws. Low use of contraceptive, especially among young and unmarried adolescents. High unsatisfied need for family planning and child labor issue still exist in country. That is why we need to more investment and focus on adolescents and young people, especially their sexual reproductive health and development that generate for the better future. Next, please. At our intention to improve the adolescent and young people health development, we want to make the health service to a standard that equitable. All adolescents, not just some proof adolescents, are able to obtain to health services that are available. Accessible adolescents are able to obtain the health services that are available. Acceptable adolescents are waiting to obtain the health services that are available. Appropriate, the right health service, i.e. one they need, are provided to them. Effective, the right health services are provided in the right way and make a positive contribute to their health. We are start from the policy into action as integrate adolescent youth-friendly services to the National Health RMNCAH strategy, develop and endorse RMNCAH policy that adolescent and youth-friendly service include, develop national RYFS and roll out to the sub-national and communities, partnership with private sector. At the services, centralize and introduce a YFS program to provincial and district manager training, strengthen capacity, institute and civil society organization trained to implement the right-based and gender-sensitive adolescent sexual and AYFS guidelines. We have improved the health facility to be more friendly to adolescents and young people, such as establish the adolescent youth-friendly service room. The provider can provide ASRH service to adolescents and young people. We do outreach and mobile clinic to reaching more adolescents and young people in the communities, as well as bring the ASRH service and information to the most valuable and marginalized group to difficult access to the service such as domestic migration and young. Working with factory on building capacity of provider at factory clinic strengthening ASRH care editor. As the result, we will moderate the AYFS program. We could see the number of adolescents and young people increase access to the ASRH services at the public health facility. At this result, this represent that we are making services more friendly to adolescents and young people. That could increase, transform adolescents and young people when they need the services and services in for them. So that's my present is right here, and now we hand over to Sally for it to continue her present about education and service. Please, Sally.
Thank you, Dr. Sumana. Sorry, Muriel, can you go back to that previous slide? Yes, I just want to add, because Dr. Sumana talked about the traditional ways of information and service provision. So I would like to just share a few innovative ways that are being offered in Laos too. Some of these are the hotlines, where young people can anonymously call and find out information. They can be supported by trained counselors and getting the right referral to health providers. We also have a mobile app called Noyaku, which provides ASRH information, which is accessible to anyone who has a mobile phone with the Android system. And of course, the Duke-NUS Center, who we have been working with for a number of years, also use the social media posting to provide information to young people who are forever, as you know, checking their Facebook, etc. But the newest modality that's being used now, it's a telehealth piece, which was started during the COVID situation to ensure services to community during the lockdown, but it's now being expanded to cover other services, including the adolescent health. Next one. So we talk about us providing services, information and services, but young people themselves are also involved in the process. I just want to highlight a few examples here. We have supported the campaign called Me, My Body, My Country, the Environment. This campaign, it's where the young people not only try to look after their health, but also the health of the environment that they live in. So they are involved in this campaign. The other example is to work with peer educators, both in factories and in schools where young people are selected. They are trained and they can provide ASRH information to their friends, and also making referral to healthcare services. And we also support different groups of young people so that they become our volunteers who can take part and speak about their issues in various workshops, in meetings. And these, they can provide their perspective and also sharing the needs from young people. And one example here is the workshop that we organized to actually have them help develop the next country program for UNFPA. And different young people, different groups have attended and provide their input. So these are the different ways that young people can also participate in their own information and service provision. Next, I think that's my last one. Thank you.
All right, Dr. Sumana and Sally, thank you very much for bringing to life some of the regional issues that Siva mentioned. And we note the right to health and how it's being delivered in Laos PDR vis-a-vis adolescents. I also want to highlight that for Sustainable Development Goal Indicator 5.6.2 on bodily autonomy, Laos actually is one of the countries that scored the highest with 96 out of 100 points because of the excellent policy and legislative framework that exists in the country. And Sally, you highlighted how youth engagement and leadership is also a big piece of the program. And this is also what Siva mentioned about nothing for us without us. So the spotlight on Laos, I think, was well presented and articulated. I'd like to now go over to the fourth speaker for today. And this is Miss Nilu Eka. And she's the Youth Country Coordinator of Get Up, Speak Out, the GUSO program in Indonesia, which is managed by the One Vision Alliance. She's worked as a program manager of GUSO in Indonesia Planned Parenthood Association, based out of Bali from 2016 until 2020. She's got experience of working on sexual reproductive health and rights issues since 2015 as a peer educator, comprehensive sexuality education facilitator, and youth advocate. Currently, she works as an advocacy consultant in the International Planned Parenthood Association, working closely with local government in Denpasar, Bali. Eka, over to you.
Yeah, thank you very much, Mariam. So good afternoon, everyone. Hope everyone are doing great today. So I'd like to share my presentations. Yeah. So, well, actually, the previous speaker already talked about the youth involvement in the sexual and reproductive health programs, but now I'd like to share my experience working with the others young peoples in sexual and reproductive health programs in Indonesia. So, yeah, for the outline of my presentations today, I have two kinds of things that I would like to share today. The first one is our experience conducted sexual and reproductive health educations under the Get Up, Speak Out programs in Indonesia, and the meaningful youth involvement within the programs. Yeah, so beforehand, I'd like to share about the context of the adolescent sexual and reproductive health in Indonesia. So if we're talking about the child marriage in Indonesia, so the number is still quite high, where 37.91% adolescent aged less than 16 years get married, based on the data of Indonesian Children's 2018. And 7 out of 20 girls who are married and diverse have experienced first pregnancy before 15 years old. So kind of forced marriage and child marriage in Indonesia still become a concerning issue right now. And also the HIV infections that reported higher numbers in the reproductive age group, as well as adolescents itself. And what happens in the adolescence and sexual and reproductive health educations in Indonesia? So basically, if you're talking about the policy or the systems that happens in Indonesia, the Republic of Indonesian governments already have the regulations or the policy that ensure young peoples or adolescents get information, educations, and also sexual and reproductive health services. But the question is, how is the implementations of that kind of policy? Well, the implementations of the sexual and reproductive health educations in Indonesia still really face the challenge. And then several implementations of sexual educations, starting from the extracurricular in schools, community-based educations, and also the others activities that engage young people in sexual and reproductive health educations. But actually the comprehensiveness is still questionable. And also the challenge that we faced in Indonesia about the sexual and reproductive health educations is about the integrations in educational system, because the education is not integrated in educational systems, for example, in schools. So not all of the young people receive the sexual and reproductive health educations. We know that the young people that kind of have a privilege to get a good quality educations, maybe they get the information about the sexual and reproductive health from schools or from the online platforms. But how about the local people or the local young peoples that really struggling on accessing internet or technology? So that's still questionable, and also lack of comprehensiveness. And we also find out that the sexual and reproductive health educations in Indonesia still use fear-based approach, where there are so many don'ts informations that giving to the young people, so make young people fear to knowing about the sexual informations, to know about the reproductive health, because the informations is most likely into the negative tone. And then the social norm and cultural dilemma is what the previous speaker said, that we in Indonesia, with the majority of people have religion, of course, and very strong cultural aspect, talking or discussing about the sexual issue is still taboo. So that's why it's challenging for us also to openly discuss about the sexual health and reproductive health in the community, especially if we are not sensitive to their cultural or the social norms. And the last one is the lack of the young people involvement, also as a challenge, because as we know that because of these educations for young people, so it has to be relevant to the young people's needs. So that's why the importance of the involvement of young people in the program design. So what happens in the Get Out, Speak Out programs? Starting from that challenges and also the existing conditions before 2016. So we kind of conducting the programs that aims to equip adolescents with the knowledge, skills, attitudes, and value that will empower them to have informed choice related to their sexual life. With the youth-centered approach, means that young people not only as end beneficiaries, but also as key actors that conducting the comprehensive sexuality educations. We kind of have 3 kinds of GSE, that is GSE in schools, GSE out of schools, that community-based approach, and also GSE for students with intellectual disability that also developed with the Ministry of Education and Culture of Indonesia. So some more young people have been reached with comprehensive sexual educations, and now we already have the results that more and more young people feel empowered and feel really satisfied that they can know and understand about their body changes, about their power to make a choice, or to discuss openly about the sexual health and life. Yeah, and also with regards to educators who are trained, including young peoples, there are more than 3,000 educators, including young facilitators, teachers, community leaders, religious leaders. And if we're talking about the youth involvement, where we all know, believe, and agree that young people have to be involved in the programs or in the sexual and reproductive health programs. But the question is the involvement or the participations is meaningful? Is the participations and involvement of young people is empowering young people that involved in the programs? So based on my experience as young people itself that already involved in the sexual and reproductive health for about 5 years until right now, the first basic value that we believe participation is a human right. And to make the participation as meaningful is another homework to do. For us, for young people to fully and meaningfully participated in the programs. So there must be opportunities for having responsibility for decision making, and those for power sharing between youth and adults. It doesn't mean that young people already involved just attending the meeting or just discussing with other adults or doing discussions in the local governments or higher level meeting with the government. It means that young people is already involved. So we value the engagement or the involvement further or beyond than that participation. So that's why we can see the 3 key strategies that we see the involvement or the participations is meaningful. The first one is structurally involved, means that there are the systems that ensure young people's voices be heard in the system. The second one is the positive youth-adult partnership, where there are mutual understanding between young peoples and also adults about the youth participation itself. And the third one is the capacity building, because we know that young people have different needs and different ability to participate within the program. Yeah, why it works. So there are reflections from AGUSA programs. So young people as the center of the programs. So it's not only youth country coordinator as what I've been responsible to within the programs. There are also young program manager, young program officer, young researcher, youth advocates, and in the AGUSA program, it's about nearly 95% the people that work in the programs are young people under 25 years old. So when it works, so first of all, increase the reach, of course, attractiveness, relevance, and effectiveness of interventions, as it enhances the fit between interventions and the contextual realities and needs of young people. So it's because related to the relevance and also the reality of what happens in the community. And also the last slide and the last message from us as a young people is that we have to remember that young people have different needs, different likes, different interests, ambitions, skills, and abilities. So that's why the local conditions about their conditions of life, about their accessible to technology, accessible to the health services have to be considered as their own unique conditions. So that's why we have to provide as much as possible the opportunity to take a part within the programs. So it also influences what can be done by the young people and how much the young people can meaningfully engage within the program. Yeah, so that's all of my presentations and also reflections from the programs. So terima kasih and thank you very much. Hand over to you, Mariam.
Very good. Thank you so much, Eka. So colleagues, we have heard from our speakers today. We already have some questions on hand, but please feel free to put in any questions you may have in the Q&A box. Eka, it was really good to see you mention and highlight the disability those with disabilities and their particular needs for information. You also spoke about the meaningful participation strategies, that they should be structural, they should be on the basis of partnership, and they should also be on the basis of capacity building and giving space to young people. And of course, the last point that you mentioned is the difference. Services for young people do need to be different. So I will, as we wait for more live questions, I'd like to go back to Siva. You started to give us the overview of the context, and I know you've done many reports on how rights and policies have changed over the years. But I'd like to hear, Siva, about advocating. When you advocate on issues of rights and reproductive rights and sexual rights and gender equality, there's a lot of pushback. Policies, legislation are often progressive, their implementation not so, and the knowledge people have about them is also quite limited. So when this pushback happens, how do you deal with it? And what are some tips you could offer to others on the call today?
Yeah, I think, you know, a lot of people look at the United States and say, oh, well, you know, rollback on rights happens there as well, right? But as all of us who work on sexual and reproductive health and rights in the Asia Pacific region, we are used to this idea of parliamentarians and ministers looking at us as though we are bringing into it some sort of liberal foreign agenda. You know, so I think the first thing always that we have to do is we have to ground our agenda in the communities and the constituencies that are within our countries, you know, because this agenda is about our people at the ground and on the grassroots, right? So which is where that monitoring, you know, finding that data, creating the leaders, you know, bringing forth the young peoples from our countries itself to elevate them to a regional or a global scenario, you know, it's really important to do that. So one, we start by grounding the issue. The second thing is, of course, to collaborate and work together, you know, across different movements. And this includes women's rights movements, human rights movements, and of course, youth movement. And I think that about, I think, 1 year back or 1.5 years back, just at the beginning of the COVID-19 pandemic, I'm quite sure that Eka can tell you this lovely story of how, you know, the Indonesian government was coming, you know, with a very repressive law on comprehensive sexuality education. But, you know, people were on the streets, you know, together, you know, all the different movements in order to say what an unfair situation that was and to ask for that, you know, law to be repealed. So I think that collaboration with all of the other NGO movements in our country is very important for in order to counter this pushback, right? The third thing, of course, is to keep reminding our governments that, you know, they have signed on to international conventions. They have signed on to international development architectures, you know, and they, I mean, like, we didn't force their hand to sign, they went willingly and signed it, and hence they need to be accountable to it. Then in many of our countries, you can see that either gender equality or the right to equality or the right to health is in some form enshrined in our constitution itself, right? And from that constitution, it is enshrined in the laws of the land, you know, whether it's a health policy or whatever. So that's where our rights are derived from, you know. So when every time they try to stop a young person from accessing their health and rights, that's not existing in the policy, because there's no way a government can go and say, well, I refuse to give contraceptives to an unmarried person, right? That is their own provider bias that is coming into the interpretation of the law. So I think that these are one of the ways in which that we really kind of strengthen that and bolster, you know, and make sure we have a wall to hold the fort, you know. So I think that those are some of the strategies we can look at. But I think for all of us who work in sexual and reproductive health and rights, you know, this pushback and this opposition is what makes us really, like, you know, fired up.
Keeps us going also, I think, that back and forth. Thanks, Siva. I think what I'm hearing, you spoke about grounding alliances and movements and reminding governments. And that's really the heart of the civil society movement, isn't it? To be informed, to know the laws, and to be able to articulate them to the duty bearers who are supposed to be implementing them. So that's really great to hear. I'd like to move over to Dr. Sumana and Sally. We heard about the international commitments, and I shared how Lao PDR scored really well on one of the bodily autonomy indicators. Dr. Sumana, could you share with us how the Ministry of Health in Laos has gone about developing such progressive policy framework around adolescent and sexual reproductive health? And what advice would you have to give to others working in the health sectors, maybe which are facing more of an uphill battle in rolling out adolescent sexual reproductive health services? Because we really see the range of in-facility, mobile, online, on Facebook, I know also, and telehealth now since COVID. So over to you, Dr. Sumana.
Thank you, Dr. Mariam. I want to share about how MOS to develop the progress of framework. We start from the national agenda that we want to reduce the adolescent birth rate and contribute to the reduction of maternal mortality in country. The adolescent sexual and reproductive health has been included into national agenda that RMNACH strategy and policy, which ensure that sexual and reproductive health is accessible for all, including adolescents and young people group. Some countries may do the same, and some countries may not implement different implement. But in behaviours, we have only Vientiane Youth Center that provide comprehensive adolescent and young people and youth-friendly service in the country. As you know, from my presentation, we are a multi-use country with a highly dispersed and thinly spread population. To have the spread, separate the RYFS center is very high cost and not able to coverage on adolescents and young people who are living in far away, where is the remote and difficult access to the center. At this reason, we are in turn to improve our existing services and facility to be more friendly and acceptable for adolescents and young people. This may not easy way to make it happen softly, but when the RYFS services exist, we can make it better and sustainable. That is I want to share.
Thank you for that, Dr. Sumana. So what I'm hearing is really an application of what Siva mentioned, that when countries sign on to the international commitments, owning that agenda at the national level and transcribing it is really what Laos managed to do. And the responsiveness also to the demographic context and to the geography of the country with a sparse population has allowed the range of modalities in service delivery and information sharing, which is good to hear. Eka, I'd like to come to you now. And I found your last slide very good. It's about reminding everyone in the health sector and the policy framework, adults basically, who are in positions of authority to make choices and decisions, that what young people like and dislike and need is different. So could you share with us, based on your experience as a young advocate, what you may consider one of the best examples of youth-friendly services that you've come across? And I'd really like to know what makes them the best in your opinion.
Yeah, thank you, Mariam. So basically, the word best for me, it refers to the youth-friendly services, of course, that where the services is affordable, accessible, and also free of stigma. And well, actually, our Ministry of Health really open for collaborations with the non-government organizations, including our alliance, where before pandemic, we developed the community health-based services called Posyandu Remaja, or community health-based services that also involve young people to conduct the health services. So young people not only become the end beneficiaries, but also were trained to help the health workers to deliver some kind of services that that also they can do, of course, because as I mentioned before, that to really empower young people to really meaningfully engage them, we have to giving them responsibility and also opportunity to take part in the initiative or in the services. So that's one of the kind of health services that I think really accessible, because that is the free health services for young people. So so the public health services or the primary health care under the Ministry of Health coming to the youth community or the youth group to giving the health services, starting from the general screening for the young people's health, as well as providing the consultations, the counseling with regards to the sexual health issues as well, and providing information. So I think that's really comprehensive health services, not only physically services, but also lead to the psychological services as well. And yeah, but because of the pandemic, everything has changed, of course. So because we're not allowed to going to the field or going to meet each other, so every service is really struggling, and then the transitions is going to online services, as what in the Laos experience, where there are telemedicine or online health services that also happen in Indonesia. So I'd like to share what me and my co-workers or my colleague as a young people as well, to develop the online consultations or the online counseling that provided by the peer counselors, that also young people under 25 years old that already trained to be counselor. So first, we released that kind of online services on March 2020. So that online services reach up to 40 adolescents. So I think that's really unexpected experience like that we could receive. So means that young people really need that kind of consultations, not only physical services, but also kind of like mental health services that we believe that also related to the sexual health as well. So I think that's kind of online health services for now during this pandemic become a better health services where the young people can access for free and then accessible and are free of stigma, of course, because the counselor are the young people itself. And this kind of health counseling also connected to the primary health care and also public health services, as well as the services for the sexual and gender-based violence. So I think that's two kinds of services that, again, meaningfully involve young people in the best services, where the young people also take part in providing these services. Yeah, I think that's the experience that I had.
Thanks, Eka. So it's good. I think you really expanded on what it means, the meaningful participation. And you spoke about getting young people involved in the design stage also, and making sure that the general screening at the primary health level be the entry point from where you could go into more specialized. And that's a really important point, I think. And of course, the free, accessible and youth counselors, many countries are beginning to get that rolling. But the piece that I think is the topic of the day, especially with COVID, is the mental health and psychosocial pieces. Anyone who follows tennis or the Olympics will have seen that one of the best gymnasts in the world pulled out of the gymnastics finals, Simone Biles, for mental health reasons. And then Naomi Osaka, another young person who is one of the best tennis players in the world, recently pulled out of a tournament or two also. So mental health, beyond any doubt, is going to be a growing piece of healthcare. There is no doubt on that. And thanks for highlighting. this piece. But connected to what you have said, I'd like to go back to Siva, because you mentioned with COVID how everything has changed, Eka. And Siva, we know that funding is going down. And there is peaks and there is lows of funding, but the COVID pandemic has certainly shifted funding. And what do you anticipate is going to happen to women's rights? Do you see that already being impacted vis-a-vis the cycles of funding?
Yeah, so I think definitely we have seen at national levels a kind of a shift away, right? Because the health sector is just focusing on containing the pandemic, and the toll on our health systems has been, really humongous. I mean, like we can see that they had to expand and not only, beds and hospitals and ventilators, oxygen, PPE, they had to go into things like doing contact tracing, quarantining, testing there, this whole thing. And then you have vaccination, which is like no mean feat, especially like in countries like Indonesia, you have to vaccinate 100 million people, right? And then access to those vaccines. So these are the kind of issues that they're all like struggling with, or the health system is struggling with. So definitely at the national level, resources are being diverted, in order to handle the pandemic. I think for those who are dependent on donor funds like NGOs and civil society, we have actually never had the luxury of having such overwhelming support that, now that we are seeing such shrinking of funds. So generally, the consistent funders are still continuing to fund the agenda. I think that the Generation Equality Forum that UN Women organized was actually able to spotlight the issues, and it was really great to have an entire action coalition dedicated to bodily autonomy and SRHR, right? So that also kind of elevated that issue, and amongst donor governments, again, positioned the agenda in their minds, right, and in their priorities. But definitely we have to actually look at how is it that the health system, because you see, in our countries, we're not even looking at the other things that are happening in SRHR due to COVID. So last year when we handled the pandemic in Malaysia, we didn't experience anything about maternal deaths so far. But this year with the Delta variant, we're actually seeing young women who are in various stages, either the 6th month or 7th month of pregnancy, having to actually, contracting COVID, and then they have to be intubated. And then for them, before they're intubated, you have to have a C-section, and then the baby is placed in an incubator. And we're also finding that, the deterioration in pregnant women is really very much greater or faster compared to what was seen before, right? And yet, there are no hospital beds to keep these women under observation. So I think that there's going to be a whole repercussion around of this, and hopefully the government's response will actually be to free up other SRHR services, right? To make contraceptives more freely available through either NGOs or through other sorts of, non-profit service providers. And hence, enabling access to some of those issues, or in some thing about access to maybe early termination of pregnancy, maybe self-managed abortion where it's legal, so some of those, hopefully that could be the response. But we don't know whether any of our governments are thinking such long term or such big picture, because I think they are just based on annual, let's finish this year and then next year, every time they're just thinking about 1-year targets. But this is going to be with us for a while, I think. I remember that someone was pointing out in an essay that it took us 200 years to get rid of polio in the world, so. Yeah, I mean, I don't think it'll be 200 years, but it's not going to be just 2 years either, so.
Indeed. And while we're both smiling, I think funding cuts are no joke. And a lot of the questions coming in are also some people wanting to help and some people speaking to how do you reach some of the most vulnerable. And I think the diversity of the range of services is very important. But an important point, I'm conscious of the time, but very quickly, Sally or Dr. Sumana, I'd like to speak about male engagement. A young girl doesn't get pregnant by herself. It takes a boy, it takes a man usually, unless she goes to a fertility clinic, which rarely happens at the age of 15, of course. So let's hear about what are some of the plans to increase male engagement in information and knowledge for sexual reproductive health. Briefly, because I'm very conscious of time.
Yes, I think I'm taking this one. I think Dr. Somana nodded. Right. So for UNFPA in Laos, we have been working in this area for a number of years in terms of the support that we provide to MOH is through the primary health care, where we actually work with village health volunteers to work with the communities to provide key messages to men, to support women and girls in their community. And recently, the work that we are doing with Lao Women's Union and Lao Youth Union is to also include this male engagement as a training that can be done through various groups, which is again being done at community level. So more and more, we are trying to bring in the men, not only to support women during pregnancy, but also to actually understand the wider gender issue that can affect women if they are not part of the solution. So I think that's basically, you know, we have been doing this for a few more years, but this male engagement piece, it's a new one coming in.
Thank you, Sally. Colleagues, I've seen a lot of the questions, and I think the panelists have done a very good job in sharing the scale of from the central policy level to how service delivery and the range of options that are being done, and how young people are demanding and asking for certain types of services. And if we really are listening to them, then we need to be engaging them, as Eka said, in a meaningful way from the design stage onwards, and allowing for mental as well as physical consultations, but also online and virtual, which many countries are doing more and more. The issue of funding shortages is one that's going to continue. Adolescent sexual reproductive health might be hit just like other services are going to be hit, but having that ownership of this agenda of sexual reproductive health and rights for young people, amongst the young people, amongst civil society, amongst duty bearers who are policymakers and health service providers, and who are committed to continuity of these services, is certainly part of the effort to make sure that this does not get perceived as an externally funded or foreign influence, but it's about human rights, the rights of young people, and the duty of those of us in positions of power and authority to fulfill those rights. I'm conscious of the time. I'd really like to thank our panelists who did an excellent job of showcasing the range of efforts it takes to develop policy, implement in the service delivery, and make sure that quality and accessibility is there by engaging young people themselves. So Siva, Dr. Sumana, Sally, and Eka, big thanks to all of you. This was the third webinar in the series of these 4 webinars that UNFPA Laos is doing with the Sing Health Duke Universities. I'd like to thank all the collaborators, and I invite the 120 or so colleagues who joined us today to tune in next week on the 4th of August, same time, for the last in the series of the webinars. Thank you again. We've taken note of some of the questions. Thank you to the speakers, and we look forward to engaging with you again next week. Kop chai lai lai, as they say in Lao PDR. Thank you. Good afternoon, everyone. Good evening.
Thank you.
Dr. Mariam.